Preparing for a procedure with a pediatric patient presents a unique set of challenges. As a resident, you need to work with nurses, child life specialists, and the patient's caregiver to successfully manage invasive procedures. Over the next few minutes, we'll introduce you to LEAPP. LEAPP is a procedural management protocol used to reduce the negative effects of invasive procedures and improve patient and caregiver satisfaction. Residents are often pulled in many directions and under pressure to get things done and get them done fast. Taking the time to LEAPP, listen, evaluate, anticipate, plan, and proceed before performing an invasive procedure on a pediatric patient will help you better manage your time, but more importantly, it will help provide safe and efficient care. LEAPP is an evidence-based, multidisciplinary approach that involves physicians, nurses, child life specialists, the patient and their caregiver working together to minimize patient pain and distress while maximizing efficiency and safety.
The Children's Hospital is really a facility where everyone who works in the hospital, from the medical director through nurses and child life, environmental services, is oriented toward working with a very special group of patients, children. So for that reason, what we really try to do is minimize as much as we can stress and tension, not only in the child, but in the child's parent, because in the end, it's really going to help the child to heal.
Patients and caregivers report that invasive procedures can be one of the most stressful events of hospitalization. LEAPP guidelines should be used when preparing for every invasive procedure on any pediatric patient. These procedures include wound or burn care, dressing changes, cast cut down, any incision and drainage, tube or line placement or removal, staple or stitches removal, packing change or removal, procedures requiring a scope, lumbar puncture, or any other invasive procedure. The first step of LEAPP is to listen. When you know a procedure is necessary, consult with the patient's nurse and the child life specialist to initiate the LEAPP protocol. Listen to their assessment of the patient's ability to tolerate the procedure, both physically and emotionally. It's also important to listen to and address any concerns expressed by the patient and caregiver.
It's really important to listen to the concerns of the patient and family because those concerns can help us make the procedure go more smoothly for both the patient and the provider.
The one person that knows the child much better than anybody else is the parent. And next to the parent would be the nurse taking care of the child.
For me, a lot of times the nurses will actually have a good handle on the patient. You know, when you go up, they'll say, well, you know, this child pretty anxious, or this is a very stoic child. So even if they're hurting, they're not going to say they're hurt. Or if there's a kid that everything hurts. So that information is very, very helpful.
The second step is to evaluate. Before beginning a procedure, it is important to evaluate and address the patient's current level of discomfort, as well as anticipate the pain and anxiety the procedure may add. The patient's nurse will provide a procedural history. This will tell you if a patient has had difficulty tolerating previous procedures and how they may tolerate the upcoming one.
If it's a child who's had other procedures previously, knowing how they reacted to those experiences, whether pre-medication or a particular non-medical intervention was useful in the past, and knowing just baseline how the kid has been. Are they having a lot of pain at baseline? Are they not having much? Those types of things are probably helpful to know ahead of time.
Pediatric patients who have experienced traumatic injury or multiple invasive procedures are more susceptible to pain and anxiety. Research shows that if procedural pain and anxiety are not well managed, it places the patient at risk for pediatric medical traumatic stress.
You really want to address both pain and anxiety needs, and we do choose different medications so that we can address both those needs, so to make the procedure as smoothly completed as possible.
The third step is to anticipate. Pediatric patients can have multiple teams following them. Consult with the nurse to determine if another team has scheduled a procedure or exam. Coordinate these events in order to minimize the amount of time a patient is in procedural distress. Then determine whether the treatment room will be used, schedule the procedure, gather supplies, and order any pain and anxiety medication that's needed.
Where's the word fox?
In addition, a child life specialist can suggest the best non-pharmacological ways to reduce the patient's pain and anxiety.
The child life specialist has a number of ways to alleviate a lot of the anxiety, and it makes a tremendous difference. And I think the residents have to see it a few times before they really buy in to the idea that this is something that is really reasonable and worthwhile.
The fourth step is plan.
Today we're going to take off his bandages, and most kids tolerate it pretty well.
When planning a procedure, the needs of the patient and caregiver are paramount. They need to understand the procedure and the steps involved. When preparing pediatric patients, it is important to keep in mind their developmental level and past experiences. A child life specialist can suggest developmentally appropriate ways to talk about the procedure. Before a procedure begins, the team should identify the one person who will give the patient information or request specific behavior, such as hold still. When several people are talking, the patient can become overstimulated, confused, or lose the ability to focus. Also, identify ahead of time who will be responsible for assessing procedural distress.
Good idea. Okay, Michelle, I need you to really be my eyes and ears. I need to know if there's any signs of pain while we're doing this procedure.
Pediatric nurses and child life specialists are trained in measuring how well the patient is tolerating a procedure. Finally, create a backup plan in case the patient isn't able to tolerate the procedure. The final step in the LEAPP protocol is to proceed.
Gotta hold still. Let's find that puzzle piece.
Proceed only when all the preparations have been completed. Make sure you have all the supplies and staff members necessary to perform the procedure. If medications have been ordered and given, wait until they have reached their desired effect before beginning the procedure. Proceeding before or after the medications have reached their peak effect defeats the purpose of administering the medications. Minimize the patient's potential discomfort by positioning the patient only when you are truly ready to begin. Focus on your clinical skills in completing the task, but be mindful of the patient's distress during the procedure. If the patient's physical or emotional response interferes with the procedure, you may have to stop and consider your backup plan.
Michelle, how do you think he's doing?
I think he's doing good. I think we can continue.
Okay.
The nurse or child life specialist who is monitoring the patient will help you with this assessment. When you see the leapfrog, remember to follow the LEAPP protocols. The Invasive Procedures Guidelines outline the policies used in LEAPP procedural management. And if you ever have a question, your patient's nurse is the best person to ask about the LEAPP protocol or best practices.
We're not trying to put more work out there for the physicians. All we need to know is what they're going to do, when they're going to do it, and what they need. And we can take care of the rest. And we'd be happy to take care of the rest.
These LEAPP guidelines are important because when you're approaching a pediatric patient, you really want to make the procedure as smooth as possible for the child and yourself as the provider. And although it might take a little bit longer, it will make your job a lot easier. It'll make the family and the patient much happier. And in the end, it will provide better care for the child.
You learn to be compassionate and looking at life from the patient's perspective.
It benefits everybody on the team, and I think the first and foremost is patient care, but it will help everybody involved in terms of having a positive experience in the management of these patients by being prepared, being considerate, and trying to do things in the least stressful way possible for the child.
There is no question that once you see this work, this is what everybody would want to do.
Remember, procedural distress can be decreased with proper planning and communication. As a resident, it's up to you to make sure the patient, the family, and the healthcare provider team are all properly prepared for the procedure. By following the simple LEAPP guidelines, you'll reduce the negative effects of procedural trauma, maximize efficiency and safety, and improve patient and caregiver satisfaction.